Welcome everyone to our webinar, Fall Prevention Month 2017, We All Have a Role to Play, Success Stories from Across Canada, facilitated by the Fall Prevention Community of Practice. My name is Mariel Ang, and I am the Project Coordinator at the Ontario Neurotrauma Foundation. ONF supports the Fall Prevention Community of Practice and its online platform called Loop. Loop is a place where fall prevention practitioners connect. Visit us at www.fallsloop.com. Marguerite Thomas also joins us on the line. Marguerite is the coordinator for the Fall Prevention Community of Practice. She will be assisting with facilitating questions in the chat box today. The Level 3 system provides visuals through the web meeting platform and audio through your computer speakers on select devices. Please try adjusting the volume on your computer in order to hear the presentation. If you are unable to hear the presentation through your computer, you may call in to the teleconference line. The phone number for the conference line and a link to the web meeting platform were sent to you by email after you registered for the webinar through Level 3. If you have any questions about the technology at any time during this presentation, please type them into the chat box on the left-hand side of your screen. Alternatively, you can email me at mariel@onf.org. I will work with you to resolve technical issues as soon as possible. There will be a question and answer period at the end of the presentation. If you have topic-related questions throughout the webinar, you may type them into the chat box at any time during the presentations. During the Q&A, questions will be read aloud to the group and presenters will be invited to answer. The webinar is being recorded and a YouTube link will be sent to all participants about 1 week along with the presentation slides. We are fortunate for this webinar to have 5 presenters speak for today, so I will be introducing each speaker prior to their presentation. Our first presenter is Emily Powell. Emily is currently working as a health promoter in rural Ontario. Emily leads fall prevention projects within the Grey Bruce Health Unit region across southwestern Ontario. Emily brings her passion for serving those living with inequities to living a healthy life to a multitude of committees working towards the prevention of falls in older adults and across the lifespan, supporting physical literacy, healthy aging, and age-friendly communities. Without further ado, please take it away, Emily.
Hi, can you hear me? I'm going to assume you can hear me. So thank you for that introduction. As was just said, I am living up in Grey Bruce in a rural region, and I'm also part of the Fall Prevention Community of Practice. And I wanted to give you a little bit of a background on how Fall Prevention Month came to be. In 2010, the Ontario Neurotrauma Foundation spearheaded the Partners for Fall Prevention Month and the Community of Practice. This was in an effort to build capacity and connections and supportive communities where adults could enjoy quality of life and maintain their independence through the prevention of falls. In 2015, the online toolkit was born. Fall Prevention Month is a campaign that encourages organizations and individuals to come together to coordinate fall prevention efforts to create a larger impact through collaboration and continuous improvement and commitment to cross-promote and work collaboratively. The toolkit has always included logos, promotional materials, a media release, sample tweets and Facebook posts, and fall prevention resources, as well as suggested activities and planning guides. This year, we have a group of stakeholders populating a section on falls in children, which is really exciting, especially for those of us who work in falls across the lifespan. As always, what sets us apart is a go-to resource is our activities. We're always looking to improve our content, and we welcome suggestions for content. We want our toolkit activities to be grab and go for those looking to access them, and we're always looking to include events across Canada in our calendar and welcome any additions which we can help promote. Of course, as always, if you need help adding an activity or figuring out how to post on Loop or how to access something in the toolkit, the Community of Practice has supportive staff to help you, and anyone from the team on Loop can help you with that. I'm glad the beeping stopped. So another thing that's new this time around is we now have a knowledge broker. So Allison Sterling is our experienced knowledge broker, and she's going to be able to help us to, she will work with you to determine the scope of your questions, suggest levels of evidence available, establish what types of resources you're looking for. She can search all levels of evidence from peer-reviewed information to gray literature. And if you look at the request for information form now, there's quite a bit more information in there to kind of break down what you might be looking for. And in the end, you should have something that is a usable product with summarized information that highlights the key findings. And it's still free. So this is just a screenshot of me looking like, pretending I was going to make a request for information. Which I have certainly made lots of them. So part of what we do there too is that if somebody asks a question and that information would be helpful to others in the group, it may be posted in discussions or it may be used in other ways. So that's the only thing. Oops, I guess I should have changed. Oh no, it's Canada. Yeah, sorry. So we're also on Twitter, so you can find us at FallPreventCA. If you were following us on Twitter before, we were FallPreventON, and now we're CA. And our hashtag is much the same as last year, PreventFalls, but 2018. Also, we have a YouTube channel, and you can go to our YouTube channel where you can access recordings such as this webinar and many others that have happened previously. Another exciting thing this year is you can now find us on Facebook. So find us and like us, and share our website and look there for other resources as well. So now I'm going to switch gears a little bit to tell you about what we've done in our region. So I work mostly in the Grey Bruce region and throughout southwestern Ontario. And we have a group that gets together regularly to coordinate our falls. I honestly had a hard time deciding how many logos to put on here because I feel like I wear so many hats. I could have so many logos you wouldn't be able to see any words on the screen. So last year we did a number of things for our Prevent Falls campaign. Did a deputation to City Council where we briefed the City Council on the aging demographic for our region and our fall rates. We provided many fall prevention education events. We found that going to where people already were was a really good strategy. So when we hosted an event, we got 45 people, and a week later we went to a dining program where 45 people were sitting waiting for us to come speak. And I can tell you it took a lot less work to go to the event that was already happening than it did to have our own event. One of our long-term care homes, Elgin Abbey, we supported them in hosting an RNAO Best Practice Spotlight event, which was really, really nice. And we had multiple fall prevention displays in libraries and hospitals and anywhere we could put them. We also had a new idea to have a booth at an OHL hockey game. And so the Owen Sound Attack were playing, and so we were able to go there. And I was really happy to have my good friend Judy Porteous from Osteoporosis Canada suggest let's do something that is specific rather than all of our fall prevention messages. And so that's how Safe Winter Walking was born. And we focused on walking in snow and ice. And we have now created within the toolkit a section on safe winter walking. And also Marguerite Thomas helps with that. And we have now a PowerPoint. We have a how to set up a display the way I did. Not that that means you have to do it that way. We have a brochure that anyone can print as is, or you can contact me to adapt for if you want to put your logo on it. For Safe Winter Walking, we did an evidence-based review of what is out there, which we also have available. And we also created a poster for that as well. We were interviewed on Rogers Television, and I used the media tips in the toolkit. So the toolkit, rather than creating our own media tips, actually links out to a website that's got fantastic tips on how to create a letter to the editor, how to respond when someone might call you from the media and what they might ask. And when I did have someone call me from the media, they literally asked the exact question that was written in one of those tips. And we did some social media sample posts in partnership with another one of the health units in our region. Those were pictures and words and things to say in there. So our region, just to give you a little bit of an idea, I know I got a little carried away with the graphics on PowerPoint, but we have what we call a constellation model. And so we do have the Grey Bruce program, and the Grey Bruce sort of reports up to the Southwestern Ontario, which is the Southwest Lynn region, and Erie St. Clair. And then at our Grey Bruce Fall Prevention program, we have partners from paramedic, long-term care, hospitals, Osteoporosis Canada, ONF, family health teams, and more that bring that to life. And then we break off into smaller groups to work on specific issues based on our community. Our coalition for the prevention of falls are the doers, and so those are the ones who mostly do the fall prevention month activities. So also last year we were featured, Marguerite Thomas and I authored an article in Grey Bruce and Huron Press Boomers, which is a magazine that gets quite a bit of traction, and we're also going to be doing that again this year. This year we'll be talking about falls across the lifespan, but last year we were really sticking to that winter walking. There's a little image of the winter walking brochure and the poster. So I always like to have posters and brochures that don't portray people as overly looking the same or overly wealthy. But then I have recently found out that there's some evidence that a smiling face is actually really helpful in getting people to pick something up. So I might have to figure out how to do that a little differently. The other piece that we're going to be doing this year, the two big pieces are each of the libraries are going to get a kit so that they can create their own window display. And so we'll be doing that to all the libraries in our region. So a bunch of bins with all the posters, the books, some balls, some different things that relate to fall prevention. And lastly, we're going to be doing some social media videos that are it's actually images. Hello? Oh, can you hear me?
Yep, you're still on there, Emily.
Okay, it just cut out for a minute. So it will start with an image like this, and 5 images stream through really quickly. And so it sort of looks like the image is changing when you have them lined up perfectly, and those are going to be posted through the Facebook website, and anyone is welcome to take those. And we moved away from putting our logo on those and just put the Fall Prevention Month so that anyone can use them, so watch for those. And I hope that wasn't too long, so if anyone has any questions, I'm happy to answer them, or you can connect with me after as well.
Wonderful. Thank you so much, Emily, for your presentation. If anyone has any questions specific for Emily, please do type them into the chat box right now, and we will be sure to flag them for our Q&A session that will happen at the end of all other presentations. So we're going to move into our second presenter, who is Riley Clothamer. Riley is a public health nurse in the Health Promotion and Family Health Division of the Renfrew County and District Health Unit. Riley has been at the health unit since 2014. Her current role involves implementing public health interventions using a comprehensive health promotion approach that addresses risk and protective factors to reduce the burden of preventable injuries in substance use. She works with local and regional groups, including the Renfrew County and District Active Aging Network, and various working groups of the Champlain Falls Prevention Steering Committee. And without further ado, please take it away, Riley, once I'm able to unmute you. There you are, Riley, you're on.
Great, thank you so much for the introduction. As mentioned, my name is Riley and I'm a public health nurse from the Renfrew County and District Health Unit. And today I'm going to be sharing a collaborative success story from the Champlain Lynn area on creating a level playing field and exercise class delivery. So a few of the presentation outcomes today. I want to share a little bit about where the Champlain region is and why there was a need for our project, who was involved, and some of our successes to date. And I will include a few of our next steps because this working group is still functioning right now. So the Champlain region, for those of you that don't know, the region is just under 18,000 square kilometers, and that includes and surrounds the city of Ottawa, has approximately 1.3 million people, and makes up approximately 10% of the population of Ontario. It does have a projected growth increase that is slightly higher than the rest of Ontario. We have about 19% Francophone population, which is the largest in Ontario. We have about 3.5 Indigenous population and 16% that are seniors or people over the age of 65. And that trend seems to be growing at about a rate of 4% annually. The Champlain region is separated into 5 subregions. So we have Western Champlain, Western Ottawa, Central Ottawa, Eastern Ottawa, and Eastern Champlain. So I'm just going to provide a little bit of a background on our project before we get started. There's a regional Champlain Fall Prevention Steering Committee, and the mission of the steering committee is to provide seniors and care providers across the Champlain Lynn with knowledge, opportunity, and resources to prevent and or minimize the risk of falls. The committee has representation from key Champlain Lynn funded health care organizations across the continuum of care. So that includes primary health care providers, community support services, or any kind of specialized geriatric service. There's also representation from public health and French language providers. In 2016, the steering committee adopted the Stay on Your Feet framework. So the Stay on Your Feet framework is from Queensland, Australia, and it focuses on healthy, active aging and preventing falls among older adults in community and healthcare facilities, including hospitals, residential aged care facilities as well. The Stay on Your Feet model is supported by a range of evidence-based resources and is based on current falls prevention evidence. So when our steering committee adopted the Stay on Your Feet framework way back in 2016, a gap review was completed to better understand the issues across the system and across the region. So to attempt to streamline some of the navigation of the systems, each of the LIN subsystems launched this decision exercise chart called Which Exercise Program is Best for Me? You'll see on the slide Renfrew County and District Health Units example is up there. So this tool basically was used to assist older adults, their healthcare providers, and their care providers in determining what was the right level of exercise class that would best suit the older adult's needs. This is a multi-agency effort which standardized the description of the levels of activity for each type of class, but did allow for the regions to kind of put their own spin on it in terms of the differences in accessing and joining some of these exercise programs. During the discussion that occurred when we created this tool, it became pretty evident that there were very different scenarios of delivery in different parts of the Champlain region. And there were some concerns amongst members that not all providers were of the same standard. Specifically, there were notable differences between instructor training competencies and fall prevention class content. So with that, a working group was created. The Champlain Fall Prevention Steering Committee Exercise Class Working Group was created to determine common standards for exercise class instructors, both with training and program content. The group also was charged with exploring opportunities for better integration among the various available programs and services. So the goals of the working group were really to provide the higher level steering committee with guidance and recommendations for evidence-informed standards of training for exercise class instructors. They also wanted to provide the steering committee with guidance and recommendations for evidence-based content and evaluations. This was both quantitative and qualitative, and exercise and falls prevention classes across the Champlain. And lastly, we wanted to provide the steering committee with recommendations as to how to integrate the various programs in order to maximize existing resources. So we started with evaluating instructor training standards first, and when we started, we noted that the instructors ranged from volunteers to paid employees with a wide range of different backgrounds and competencies. So our group examined some best practice competencies from the World Health Organization and some of the national guidelines, and we collectively created a knowledge and skills framework to kind of compare the different certifications. So a small group of us used the Loop services to get 58 articles to kind of examine, and we knew that our recommendations for standards needed to be applicable and relevant across the region and be adaptable to some of our local needs. So through the literature research and working with local instructors and providers, the group was able to determine standards for exercise training and competencies. And there were 2 certifications that matched our created knowledge and skills framework. And that was the Canadian Centre for Activity and Aging Senior Fitness Instructor Certificate and the YMCA Older Adult Fitness Instructor course. So to complement that training, we also agreed as a group that the HeartWise education, which is out of the Ottawa Heart Institute, was an excellent value added because it did focus a little bit more on the chronic disease management and did have a falls prevention component as well. So we did include in our recommendation that the fall prevention class instructors should also have some additional fall prevention training. For example, something like Stand Up or any of the Canadian Centre for Activity and Aging workshops that focus on specifically strength and balance. And we did mention as well that it was very important that there was some support for training, recertification, and mentorship need to be kind of included to make sure that this model was sustainable. So also determined through our literature search was fall prevention class content. So what our team decided and what we ended up recommending to our steering committee was that fall prevention classes should include strength training, balance, flexibility, gait, mobility, an education component. Classes should run for about 12 weeks with 2 hours a week minimum. And it should be noted that 3 hours a week was a dosage that we came up with that gives a maximum benefit to the client, and that any additional programming to support the client in achieving this recommendation was also valuable. So what happened next? So what we were able to do, we had some education dollars that were kind of left over. So what we decided was to get a good kind of foundation of senior fitness instructors in our region. So we trained 59 new Canadian Centre for Activity and Aging senior fitness instructors. And we also gave our existing master trainers some updated training, and there was 1 new bilingual master trainer that was trained. In addition to the training, we really wanted to evaluate that which exercise program is best for me chart that was showed at the beginning of the presentation, and that would kind of help guide a little bit more of the working group's next steps. So the evaluation results of the which exercise program is best for me decision chart. So during Fall Prevention Month, November 2017, we went through the evaluation process for the chart. We used both online and paper copies of the survey. So we used the online platform SurveyMonkey. And we also brought, like I said, paper copies to some of the exercise classes to have participants fill it out. The survey was available in English and French. And we had a total of about 52 responses. However, we noted that about 17% were not applicable to our results because they hadn't seen our chart. So we only had about 35 that we ended up tracking. Results were about 83% had used our chart to find an exercise program for themselves. Very few participants ended up using it to find an exercise program for someone else, so be it a family member, a friend, a patient, or a client. Over 90% of the survey respondents thought that the chart was easy to use, and about 80% found an exercise program using the chart. So we noted that because of the lack of online respondents and the many replies stating that they had not seen the chart, that it was pretty evident that there needed to be some future focus on methods for distribution of the tool. So that leads me to some next steps. So in 2018, our next steps include building a sustainability plan, which is going to include mapping of some of the LIM-funded classes and models of provision, looking at both capacity, demand, and duplication. We want to focus on maximizing the use of that which exercise program is best for me navigation tool, especially in the community setting. Before I continue, I just would like to mention that this work could not have been done without the hard work and collaboration of the working group. So just take a minute to acknowledge them now. Kelly Milne, Caroline DeRoche, Christine Bidmead, Christine Gagné-Roger, France Bounet, Guy Laflèche, Heather Seaman, Jeannie Bonnell, Joanne King, Kara Symbolic, Kathy Blomquist, Mary Holler, myself, and Rick Marceau all worked together to make this project happen. And once again, if there's any questions, feel free to put them in the chat box, and I will either connect with you after the webinar or personally through email. Thank you.
Great. Thank you so much, Riley. And I'll just echo Riley's request. If you have any questions specific to her presentation, please do put them into the chat box on your screen. Great. So from here, we're going to move into our third presentation. And I would like to welcome our third presenter, who is Kim Furlong. Kim obtained her bachelor's and master's degree in physiotherapy from Dalhousie University in Halifax, Nova Scotia. She has worked in many areas of healthcare, including public and private practice in Canada and the United States. Kim has over 30 years of experience treating people with dizziness and imbalance. Kim is the owner of Newfoundland Balance and Dizziness Center in St. John's, Newfoundland, a multidisciplinary clinic dedicated to easing the symptom, burden, and healthcare concerns caused by dizziness, falls, and imbalance. And without further ado, please take it away, Kim. I've unmuted you now.
Thank you, Muriel. So back in the spring of 2017, we received an email from the Dean of Kinesiology at the faculty at Memorial University, and they were looking for some partners to help kick off the first Fall Prevention Month in Newfoundland. They had partnered with the Newfoundland Labrador Injury Prevention Coalition, and when we read the email, it was a nice fit with our clinic, our mission, and our interest in promoting fall prevention in Newfoundland and Labrador. So we jumped on that bandwagon with those partners and decided to get involved and see what we could do to help promote a Fall Prevention Month in Newfoundland in November. So the first thing we did is we were provided with access to the online toolkit by Memorial University. And at our clinic, we have kinesiology students, physiotherapy students that were here in the spring on work term. And we basically decided as physiotherapists and students to get involved in developing some kind of activities for November month. So we went online first and we pretty well scoured that lovely toolkit. And that gave us a ton of activities to peruse and think about and wonder if we could apply some of those activities and that information to developing an event list for us and our ability to participate in Fall Prevention Month. So from there, we put a little group together in our clinic. We just met over lunch times. The students, as you know, young students are great at technology and keen and full of energy. So they put together this lovely fall prevention event list for us. You can't read it there now, it's a bit small print, but I'll go through some of these activities in some future slides. So we kept in contact with the School of Kinesiology and the Injury Prevention Committee, and they held webinars all summer and into the fall, and we just kept partnering and sharing activities, and we shared with them how we wanted to become involved and what we thought we could do. So this slide just highlights some of the key activities that we took from the toolkit. Basically, we were so excited we didn't have to reinvent the wheel, and a lot of these activities we thought were fun, they're easy to read, and we grabbed hold of a lot of those and decided to put them together and use them for our activities. So I put a list there that we used. Some of our favorites were in the top right-hand corner where you can see the fall risk checklist and the hazards, point out the hazards. So we went to the printer and we printed as much of these colored, informative toolkits and information sheets that we could. And from there we used these to develop some activities that we wanted to get involved with for the month of November. So we started off with partnering with MUN and Injury Prevention and their efforts to get a proclamation officially signed to kick off Newfoundland Labrador's first Fall Prevention Month. And they were successful in getting some politicians to come to a local nursing home, and we attended, and a proclamation was signed officially kicking off the month. On the left is some of our students who went to the local mall, and we set up a booth, and we had all those lovely colored printable toolkits that we got from the Loop. And on the left, a bunch of us so happy that the month went ahead and we got it officially kicked off. And then from our own point of view, we developed a number of different activities that we thought we could do as a clinic. One was to develop an open house. So with over the summer, we planned a date, and we picked November 8th from 3 o'clock to 6 o'clock. And we basically closed down our clinic to treatment, and we opened it up to the public for an open house. We also went to the mall on November 9th. We did the proclamation signing on November 2nd. And then the students put together a little PR package to broadcast and advertise our events. So flyers went out. We sent out flyers to local doctors' clinics, physiotherapy clinics, nursing homes, and such. And on the right-hand side is the flyer that our students did up to advertise our open house. So we had that printed in color, and that's what we distributed. We put on our Facebook page, we sent it to the Loop, they put it on their community events, and we got the word out as best we could. We went to the library on November 29th, again with a lot of the toolkits, and we gave a presentation on how to prevent falls. And we also put out a road sign. We got a road sign made, put that out on the street on the day of our open house, which was November 8th. And we used that lovely logo that we got from the Loop that you can see there in the center of the poster. We also decided to develop a balance class that we wanted to offer as a community service during Fall Prevention Month. So I'll talk to that now in another few slides. Here on the right is our road sign with our balloons, and here is on the left are all the students' treats and teas and coffees. And they set up the clinic in the morning before our open house at 3 o'clock. So during the open house, I've probably said some of this, but we just had our planning committee that we got together. We distributed our flyers. We did get some radio ads out. We posted it on the Loop. And we went ahead with it, and we had about 50 people come. So what the students developed and what we promoted during the open house for those 3 hours were various different stations. So our clinic is kind of one big open gym with the treatment rooms around the periphery. So each treatment room or a different part of the gym was a station. and number 8, 1 to 8, are the 8 stations that people could go through. When they came in the door, they were given an information sheet on the stations, and we also did a draw. We did a draw and gave out a pair of activator walking poles. That's just a picture of our clinic on the left, and we have a fall protection harness. So that round silver piece of metal you see surrounding the ceiling is the track. It's about 74 feet long, and the black lines that are hanging are the lanyards which attach to our harness system like a worker would wear on a construction site. So our balance class that the students helped develop, they called iBalance, because we didn't want to call it a fall prevention class. We wanted to be very proactive, and there's iPhone, iFly, there's everything nowadays, so they titled it iBalance. And we did up a flyer. We sent the flyer out as much as we could, and during the month of November, we offered a free community iBalance exercise class. It was for 1 hour, and we could have 8 participants. And we decided to target the community ambulators who had Parkinson's, multiple sclerosis, or a stroke, because we felt those people were still quite mobile and were risk takers but had some deficits and were kind of our target group that we wanted to start the class with. So we had lots of phone calls, lots of names were put on the waiting list, and we got our first 8 participants, and we ran the class once a week for the whole month of November. This here is just a snapshot of some of the stations, some of our participants participating in one of the classes. And the classes had both a strength station, a flexibility station, a balance stations, getting up off the floor, cardio and the recumbent bike and treadmill, and some light background music. And we had lots of students, and we had a harness for every participant. And we basically had about 6 stations. Anyway, it was a huge success. It was a huge success. We were really excited about it. Our participants gave us great feedback. That was in November, and we never stopped the class after Fall Prevention Month. It's been pretty well going on ever since, every week from 11:30 to 12:30. I think that's all I had to add. Our staff was pretty excited about how Fall Prevention Month went for us. So we certainly will be participating in Fall Prevention Month in 2018. We've been keeping our ears open during these webinars, listening to everybody's ideas, and we would certainly like to expand our activities for November of 2018. We'd like to include children in some kind of fall prevention initiative. We're really excited about this Safe Winter Walking Program, and we could be doing that now in June because we had snow last week in Gander. And we're excited about some of these library window kits that we're hearing some of the other speakers talk about. Thank you very much for your time.
Wonderful. Thank you so much, Kim, and I'm sorry to hear about the snow. And so just to echo the process that we have for this webinar, if you have any questions for Kim, please do type them into the chat box in the bottom left corner, and we will address them at the Q&A session at the end of the after this last presentation. And so I will introduce our 4th and 5th presenters, Megan Oakey and Samantha Bruin. Megan is the Interim Director for the Healthy Living Programs and Injury Prevention at the BC Centre for Disease Control and a member of the BC Injury Research and Prevention Unit. Megan has over 12 years of experience working in public health, leading both health promotion and clinical practice projects. Megan is the current co-chair of the Provincial Public Health Injury Prevention Committee, which provides guidance and recommendations on injury prevention to the Provincial Public Health Executive Committee, the Ministry of Health, and the Provincial Health Officer. She also co-chairs the BC Prevention Alliance, chairs the BC Falls and Injury Prevention Coalition, and is an active member of the BC Road Safety Strategy. Megan received her Bachelor's of Human Kinetics in Exercise Science from UBC and her Master's of Public Health from the London School of Hygiene and Tropical Medicine in the UK. Samantha is the Communications Coordinator for the BC Injury Research and Prevention Unit at the Research Institute of BC Children's Hospital in Vancouver. Her job involves enhancing the unit's communication strategy and supporting a variety of projects through the content creation, media relations, social media, and the creation of reports, infographics, and other communications materials. Samantha also supports the unit's work with the Community Against Preventable Injuries. Samantha obtained her BA from the University of British Columbia and holds a certificate in marketing communications from the BC Institute of Technology. She has over 6 years of experience specializing in healthcare communications. And without further ado, I am going to let Megan and Samantha take it away once I've unmuted them. And there you are.
Thank you, Mariel. This is Megan speaking. Thanks for the introduction. We'll be presenting our BC Falls Prevention Campaign, focusing in on our social marketing efforts. We hope to provide you a bit of a background, summary on the campaign, some explanation of the social media terminology that we use, our findings from Twitter and Facebook ads, some of our takeaways, and our next steps. So the BC campaign is led by the BC Injury Research and Prevention Unit under the direction of a working group from the BC Falls and Injury Prevention Coalition. And the campaign is funded by the BC Centre for Disease Control. Like a lot of the country, our campaign runs during the whole month of November, and the provincial legislature declares the first week of November as Falls Prevention Week. The whole campaign consists of posters and self-assessment checklists that are distributed via our 80-plus flu clinics, a lot of our GP clinics, several large pharmacy chains, and traditional media. But today we'd like to focus our presentation on our social media efforts. So now I'll turn it over to Samantha, who leads the communications work for the campaign.
Thank you, Megan. So in the interest of time, as Megan said, we just want to focus today on the most interesting part of our 2017 campaign, which is social media advertising. So evidence suggests that older adults are accessing the internet in increasing numbers. Statistics Canada found that from 2013 to 2016, internet usage among adults aged 65 to 74 increased by 16%. And a 2012 report on tech-savvy seniors found that 88% of older adults 75 years and up are going online at least once a day, and 53% of these individuals belong to a social networking site such as Facebook. Given this information, we thought we would experiment with social media ads as a different way to share our campaign messages. So we ran Twitter and Facebook ads throughout the month of November promoting our fall prevention messages. And before we dive into the results, I'd like to give you some quick definitions on how Twitter and Facebook report their metrics. First of all is engagement. Engagement is the total number of interactions on a post, which includes likes, shares, retweets, and comments. Second, reach is the number of people who saw your ad or your post. And finally, impressions are the number of times that a post was displayed on a Facebook feed. This does not mean that the person necessarily saw or engaged with the ad, but it gives you an idea of exposure. This is similar to the number of cars who drive by a billboard on a highway each day. So first I'll talk about our Twitter ads. On the left of the slide is a screenshot of the advertisement we ran on Twitter. Our Twitter handle is @StopFallsBC. From November 6 to 12, we spent $145 on Twitter ads. So we only ran ads on Twitter for the Falls week. We targeted people using specific keywords such as aging, retirement, grandkids, and pension. And our ads resulted in 30 new Twitter followers and 27,000 impressions. Again, impressions are the number of times that the post was displayed on Twitter. But I really want to focus on our Facebook ads. Most of our social media efforts were spent on Facebook advertising. We ran ads before, during, and after Fall Prevention Week, October 30th to November 30th. We spent just over $4,000 for the entire month. We targeted older adults 55 years plus and family and professional caregivers 40 to 64 years of age, with separate ads targeting Indigenous populations of the same age cohorts. And before I talk about our results, I want to cover some of the lessons we learned from this campaign. First, it was a bit tricky compiling the results of the campaign. Because Facebook and Google Analytics differ in the way that they report and track their website visits, it was difficult for us to get an accurate idea of how many visits to the campaign website were a result of the ads. Second, our Google Analytics tracking was not set up properly for the first few days of Fall Prevention Week, which affected our results. And finally, we created a campaign hashtag and used it on our Facebook ads, but that resulted in people clicking on the hashtag in some instances instead of going to the Finding Balance BC website. But issues aside, we were absolutely amazed by our results. They were unexpected considering we were experimenting with advertising. So our Facebook campaign generated over 250,000 impressions and reached 110,000 people. Again, we had issues calculating the results of our ads, but we estimate that we had between 2,700 and 4,000 visits to the Finding Balance BC website as a result of our advertising. In terms of engagement, we had over 300 reactions, 36 comments, and 178 shares. During the campaign, these ads resulted in 184 new page likes for the Finding Balance BC Facebook page. So, what did we learn? We learned that social media ads are cost-effective and easy to set up, and a great way to target and segment a large population. We learned that we shouldn't use hashtags in Facebook ads. Not only are they out of style, but like I said, they were distracting from the actual goal that we wanted people to achieve, which is clicking on the website link. And finally, we learned that we need to test setup of Google Analytics. Considering these excellent results and our other campaign initiatives, we believe that last year's BC Seniors Fall Prevention Week was a success. And now I'll turn it over to Megan again.
Thank you, Samantha. That's great. So with all the traffic coming to the Finding Balance BC website, we were keen to evaluate knowledge retention of our key messages. And without going into a huge amount of detail, we did find that participants who signed up and completed the knowledge retention survey at 4 weeks and at 10 weeks did retain knowledge about some of the campaign messages. So we were very pleased to see that result. And some of our survey participants did, they were directed to the surveys through our social media that Samantha's just explained. So our next steps. We are planning, we're just about to start planning our 2018 campaign, which will look very similar to the 2017 campaign. Posters, traditional media, and a focus on social media. We are, though, starting to explore testing the knowledge, attitudes, and beliefs of older British Columbians in relation to falls and injury, as well as doing some in-depth focus testing of the Finding Balance brand. We have an award-winning injury prevention social marketing campaign in BC called Preventable that you see up there on the slide. And we're really hoping that we can develop a partnership with them in the future to expand the campaign through their messaging and their marketing. So thank you for listening, and Mary, I'll hand it back to you.
Wonderful. Thank you, Megan and Samantha, so much for your presentation. I'm going to allow the participants who might have some questions specific to the Finding Balance BC initiative type their questions in the chat box right now. And we're making some pretty good time, so we can move right into our Q&A. We do have some questions that have been asked throughout the presentations, which has been great. And so I'm going to start reading the questions out now, and I will unmute all of our presenters so that they can chime in. So our first question is from Jeanette, and I believe, Emily, this is for you, and I know you've had some discussions back and forth in the chat box already, but I will ask it aloud so that people can hear your response in case they haven't been catching up in the chat box. But Jeanette has asked, will your resources be available in French?
Yeah, and thank you for your question, Jeanette. And I apologize for my presentation earlier, that beeping made me a little bit distracted. We have done some of our Facebook videos. I say videos with quotations because it's 5 images that come through really quickly that makes it look like a video. So we have some of those in French. We haven't translated the winter walking, but after you asked, I did send off a request for a quote to have that translated. We are in not a bilingual health unit where I am, so I'm not sure if that's something that we would be able to do, or if someone else wants to do that. But we are happy to do that with someone else, and we do have some French resources.
Great, wonderful. Thank you, Emily. So again, please continue to type your questions in the chat box, and I'll just continue to read them out so that our presenters can respond. And I will mention I do apologize for the beeping that happened at the start of the presentation. I'm glad that we were able to rectify it, but thank you, Emily, for putting up with that and for pushing through your presentation. You still sounded great. And so for Kim, I believe, this is actually a question from Emily, but did you use physiotherapy students for your balance classes?
Yes, physiotherapy students and kinesiology students.
Wonderful, great. Emily, if you're still, if you want to unmute and follow up to your question, you can go ahead if you have anything else to add. There is a comment here from Lee Kim saying, send us your snow because it will be 40 degrees here in Toronto this weekend. I don't know if that's good news or bad news to you, depending on how you tolerate the heat, but he's not lying. It's supposed to be a really warm, long weekend for us. Moving along, Leslie is asking, and I believe this question is directed to Megan and Samantha in BC, when are your flu clinics?
Yes, I saw that question. Yeah, they are the same pretty much as the rest of the country. They do start right at the end of October, and they usually run through early to mid-December. They're typically run through our public health units. And we send them all posters and then self-checklists. Those posters get sent out in the end of September so that it's all ready to go for October with instructions on where to put up the posters and how to help clients coming to the flu clinics to fill out the self-assessment checklists.
Great, thank you, Samantha. And just to clarify, Leslie is in Quebec, and so she says we only do, or we only immunize beginning November 1st. I will also read out a comment by Marguerite in response to Leslie's question on flu clinics as well. In Ontario, we start in October, but there's going to be an activity from Saskatchewan in our Fall Prevention Month Toolkit this year. And Samantha and Megan have both responded to their timelines in BC, so thank you for that. We have a question here from Brittany Hillier for the first presentation. So Emily, this one looks like it's for you. There was mention of a presentation to council during Fall Prevention Month. Just wondering if there were any asks from the for the municipality.
Thank you for your question. It kind of made me laugh when I read it, actually, because they were wondering if I was asking for money or what I was asking for. And once they said that, I thought, yeah, sure, you can give me some money. But no, you can do a deputation that is just providing information. So it was just letting them know that, what the falls, we did a fall rate per in each of the municipalities in our larger region, and just talked about the key messages for preventing falls. And I would say it was I heard later that it was the most interesting presentation that they'd ever attended, and so much happened afterwards with connections to other organizations and other places where we could connect and spread our message. And so it was more just providing information. So you can do a deputation just to provide information. You still have to follow the rules of being only, I think it's 10 minutes, and you, if someone asks a question, you have to speak to the mayor, and there's some funny rules to get used to, but you can just do a information one.
Great, thank you so much, Emily. And so I'm just going to read out a comment from Marguerite. She would like to thank all of the participants who are on the line today, and she would like you to know that as she is one of the people who have worked really, really hard on the toolkit and all of the activities that were included in the toolkit last year and the years before, that this is very gratifying to see everyone's participation and everyone's questions to these activities. So thank you, and thank you for continuing to share. Thank you, Marguerite, for your comment. So if there are any other questions, please continue to type them into the chat box. I'm just going to take this time right now that I have it, to thank all 5 presenters so much for their wonderful presentations. It was so great to hear about all of the different initiatives that are happening across the country to promote fall prevention at varying levels, spanning local, regional, and provincial initiatives. I hope everyone has found it very fruitful and found it very interesting. And I would just like to say that it's great to hear everybody participating in this campaign, because I'm not sure how many are aware, but the campaign is relatively young. Our website was launched, I believe, in 2015. So we're only at year 3 right now, and the fact that we've got recognition across the country is really, really great, and I think we all deserve to pat ourselves on the back for that. So we do have a few more minutes, and if anybody would like to submit their questions in the chat box, you can still continue to do so. I'm seeing a lot of thank yous in the chat box. Emily, another Emily, not Emily Powell, one of our presenters, says thanks. It was great to hear about some amazing work happening across Canada. And so are there any other last-minute comments from any of our presenters? Oh, we do have a question actually from Samantha, one of our presenters. What campaign activity was most successful in engaging men? So if any of our presenters can comment on that.
I would say that our Safe Winter Walking one was when we did the booth at the OHL game. That was when we got the most men that we interacted with, and we had set it up with the urban walking poles, some boots, and we talked about how you can go to Toronto Rehab Institute's Rate My Tread to see, about work boots and winter boots and which ones are are rated the best for walking across snow and ice. And I would say that's when we did best, and also having information booth and not standing near it. Do you know what I mean? Like staying back so that people could just go and look but not get talked to seems to help too.
Yeah, thank you, Emily. I can definitely speak from experience that if you're standing in front of your booth, it's a little bit more intimidating. So yes, I do find that that's a more a less intimidating strategy. I would like to hear if Kim is still on the phone. did you notice any activities or any specific locations where you were promoting your open house? Anything that seemed to attract more or promote more towards men?
Yeah, Jake and I were just discussing that, and really no, our exercise class is only 2 men out of this 8 participants. Open house was predominantly females with husbands. No, we never. I don't know why.
Yeah, it's a fantastic question, Samantha, and it's I think one that a lot of people are or that we working in public health are always very puzzled about when it comes to health promotion and adopting healthy behaviors. Riley, if you're still on as well, with the exercise decision tree and with the surveys, do you have any comments on that?
No, I don't in terms of engaging men. Is that what you're asking?
Yeah.
No, I'm not even sure if we asked gender when we were looking at evaluating the tool, but something maybe to discuss for our next evaluation if we end up doing one.
Yeah, and do you find that most of the exercise professionals that you have been training, are those mostly female?
Definitely.
If you are aware?
In our area. I only really know our sub-region, but definitely they're almost all female,
okay,
if not
great.
all. Yeah.
Great. Thank you for your responses, everyone. Okay, so I'm seeing a lot more thank yous in the comment area section, and we are just past 2:30. So I would like to thank all of our participants today for joining our webinar and engaging in some great discussions. So for some more information about the Fall Prevention Community of Practice, please visit Loop at fallsloop.com. The link is on your screens right now. And we did just launch our revamped Fall Prevention Month website, so please do check it out. We have some new resources in there, some new activities, and also a new toolkit focusing on fall prevention in children ages 0 to 6, as Emily mentioned at the start of the presentation. So please feel free to check that out. And just to echo some of the other updates that Emily mentioned, we are on Twitter at FallPreventCA. We did change our Twitter handle very recently to reflect our national activity. So please feel free to follow us and retweet us. And we are also on Facebook. So you should look for our Facebook page and follow, like, and share us. And finally, please do not close this window just yet. Wait until you've been redirected to the next screen where you will have a brief evaluation survey. We'd appreciate it if you could provide some feedback so we can continue offering high-quality webinars. And that is all. Thank you so much, and have a wonderful day.